Presidency restates free movement of essential goods nationwide despite ban on interstate travels. Plus, Senate approves 850 billion naira loan request to finance 2020 budget deficit. Good day and welcome to Panorama today on the network service of the NTA. I'm Elizabeth Omori. We'll be right back. Thanks for staying with us. 195 new cases of COVID-19 have been confirmed by the Nigeria Center for Disease Control as at 11:50 p.m. on the 28th of April 2020. With this figure, 50 cases are discovered in Lagos, 38 in Kano, 15 in Ogun and Bauchi respectively, 11 in Borno and 10 in Gombe. Others are Sokoto with 9 cases, 5 in Edo and Jigawa respectively, 2 cases in Zamfara State. Rivers, Enugu, Delta, FCT and Nasarawa states have 1 case each, bringing the total figure to 1,532 cases in Nigeria. 255 persons have been discharged and death records stand at 44. 162 civil society organizations have been mobilized as volunteers to assist government in its efforts towards containing the coronavirus pandemic in the 36 states of the Federation and the Federal Capital Territory. This was at the unveiling of Situation Room on COVID-19 by the Economic, Social and Cultural Council of the African Union. The establishment of the Situation Room is in line with the African Union's stand that its organs should support government at all levels in the fight against the coronavirus pandemic.
Data gathering in audio and feature shall be collated at the Situation Room for detailed analysis to establish a firm decision to set up an advisory framework for government to have a sustainable emergency preparedness and coordination of support from all stakeholders.
Minister of State for Niger Delta, Senator Tayo Aduda said the room needs to educate the people, especially on post-COVID-19 era.
We all have a responsibility to let our people know that we will have to tighten our belts. If you are having 3 square meals now, reduce it to 2 so that you can give a helping hand of 1, to those who are less privileged.
Lessons learned from African Union member states in the fight against the virus is expected to be previewed for experience sharing. Joining me now to speak more on the Situation Room on COVID-19 by the Economic, Social and Cultural Council of the African Union is Nigeria's permanent representative to Economic, Social and Cultural Council of the African Union, Dr. Tunji Ashaolu. It's nice to have you in our studio.
Thank you for inviting me.
And I hope you are keeping safe.
Yeah, I'm trying my best.
Okay. All right. Could you tell us more on the initiative and how beneficial is this to us as a nation?
Yeah, very quickly, I think I need to start to let the public know about AU-ECOSOG. AU-ECOSOG is one of the advisory organs of the African Union. You will also agree with me that at the beginning of the outbreak of this COVID-19 in Africa, the chairperson of the African Union, which is the president of South Africa, made the declarations where he charged all the organs and agencies of the African Union to mobilize support for the government at all levels, meaning the member states, the local government and all that, to see how we can sensitize citizens, how we can also put them on track, as in all of us to speak with one effort. So in view of this, the AU-ECOSOG, being an advisory organ of the Union, have to step in. Since then, we have been working together with the government, the Ministry of Humanitarian Affairs, and even the President Task Force and all that. So, and then one of the best way to disseminate this information is for us to also establish this Situation Room, which we also just launched 3 days ago. I think from there, the purpose is to gather information, data that will form a decision that will also make us to also advise government during the COVID-19 and of course the after COVID-19.
Okay, so what is expected of members to ensure the success of this program?
Yeah, what we did is the aims of the AU ECOSOC is to mobilize the African civil society towards the implementations of the framework and the policy of African Union member states. And this civil society will be working together for some time. So they are all over the 36 states. So these are the people that are also giving out information in terms of the distribution of the palliative to the vulnerable people. And of course, we also need to also evaluate the economic stimulus of the government at all levels. And this we also form the decisions of the AU ECOSOC to also advise government. I think the sustainability of it is guaranteed.
Okay, so now we are the community transmission of the disease. How is the program addressing this to enable us to tackle it appropriately?
Yeah, it has become a serious business now. Before now, people thought that it's only a disease of the hairlight, that they cannot also come to them. Now that it has also gone to the community, I think everybody is now, trying to save their head. So this will also help us to also guide them, and of course to also advise and to also sensitize them on how to keep safe. The guidelines are all there that have been given to every one of us by the World Health Organization, of course, the African Union and the European Union. We need to keep safe. We need to keep social distances. And of course, we need to also guide yourself, because when you are moving, you should be conscious of yourself that you need to be anybody around you now is a suspect. So you have to keep safe, and you have to make sure that as you are helping yourself, you're also helping the fellow human being around you.
Okay, COVID-19. After COVID-19, what next? How do we bridge the gap?
Yeah, I think that is one of the purpose of this situation room. Of course, we have to bridge the gap. And in a statement of Mr. President 2 days ago, he also talked that we have to also, lose ourselves a little bit. So some offices will start reopening. So we need to also look at this period. It's a season why all farmers have to go back to the farm. If we lock ourselves down for beyond this time, it means that after COVID-19, what do we want to be eating? So it means that we are still going to have to face another hunger strike. So for this reason, I think gradually we should also be looking at how to the farmers will go back to farm, and we'll also be looking at it, because for now, a lot of people have lost their job.
Yes.
So the data are there that even the British, the Airways lost about 600 staffs. So considering with what we are facing in Africa about the issue of unemployment, so if we allow this to linger for so long, it will cause a lot of havoc that we may not be able to also contain. I think it's a collective responsibility. So gradually,
all right,
I believe that we'll
before
come
I
out
let you
of
go,
it.
let's talk about children, pupils, school. What will happen?
Yeah,
social distancing is there. Hand washing.
Before now, I think the COVID-19 is also changing the order of the day.
Okay.
Because you can stay at home and even learn a degree this time.
Okay.
We know about the Open University, so you don't need to even sit down in the class before you even have that certificate.
Reduce interaction.
I think the people that are in charge of that education authorities will also look at what beyond the four walls of the classroom, what could we do? So I think, and I'm sure that they're on top of that situation, which are also coming in. So in a way, if you also want to also doing it, those that we should also prioritize it. Those that are writing, that want to write exam, for example, the SS3, the GSS3, WAEC and other, I think they can give them a little bit consideration. Let them go back to the school, maintain the social distances when they write their exam, and I'm sure that already the second time is already at the close of the session, so they can write the exam and quickly they go back to
Well, actually, the SGF raised that for those writing WAEC yesterday. All right, Dr. Ashaolu, thank you so much for your time.
Thank you
for coming to our studio.
Thank you for having me.
Thank you very much.
You're welcome.
Moving on, Nasarawa State Government says it is implementing more stringent measures in tandem with federal government's directives as an index case of coronavirus pandemic emerges in the state. Governor Abdullahi Sule, at a briefing in Lafia, attributes the first case to a female traveler from Kano. Ali Tijani Mohammed reports.
Nasarawa State status has changed with the index case from Garaku community along Kefi Akwanga Road who returned from Kano.
So for the first time, we had a lady that tested in Kokwana and she's positive.
All contacts of the index case have been isolated, while the patient is being managed at the Dalhatu Arab Specialist Hospital, Lafia. Government says 14 days of quarantine awaits anyone returning from parts of the country. The total lockdown of Karo has been extended for additional 10 days, while the 8 p.m. to 6 a.m. curfew in parts of the state is still in force.
The government is drawing the attention of us to reduce movement and traveling up and down, especially with the restriction of interstate travels.
The police and other security agencies are more now focused on how to enforce proclamations and regulations.
However, farming activities are to resume across the state, while the ban on social and religious gatherings, as well as the use of motorcycles and tricycles, are still against the directives of containing the pandemic. In Lafia, Aliu Tijan Mohammed, NTA News.
Meanwhile, testing for COVID-19 has resumed at Aminu Kano Teaching Hospital. The Director General of the NCDC on his Twitter handle says this was made possible through the joint efforts of the Nigerian Center for Disease Control, the Aminu Kano Teaching Hospital, and other partners. A second laboratory at the Bayero University, Kano, will be activated today, Wednesday. Meanwhile, the Kano State government has applauded President Muhammad Buhari for the streamlined response aimed at combating the dreaded COVID-19 pandemic in the state and the country at large. The state expresses pleasure at the drastic measures announced by President Muhammad Buhari, saying that enforcement of a total lockdown for a period of 2 weeks in the state, coupled with the effort of the state government, will go a long way in containing the pandemic and prevent the risk of further spread to neighboring states. The Nigerian Center for Disease Control is proposing to test 2 million Nigerians for coronavirus in the next 3 months as part of detection and containment of the pandemic. This was disclosed at the daily briefing by the Presidential Task Force on COVID-19 in Abuja. Mitari Ikmin reports.
Following the presidential order to relax the lockdown in Lagos and Ogun states, as well as the FCT from Monday next week, the presidential task force says this does not imply the end of the pandemic.
The virus is still potent, virulent, and dangerous. We must remain very vigilant and careful.
We are in the process of drafting a detailed implementation guideline for the phased easing of the lockdown soon. It will be very specific in terms of expectations and the preparedness, both at an organizational and individual level.
The possibility of persons having coronavirus without exhibiting symptoms and the danger of community transmission are among reasons why the Nigeria Center for Disease Control is stepping up testing.
In order to test 2 million people in 3 months across the country, we need to test about 50,000 per state, plus minus depending on your population size.
We have applied to Global Fund to support us with cartridges that will allow us to do testing with our junior smart machines. Those ones are faster. The results come out in about 45 minutes to 1 hour.
Ministers responded to concerns about school resumption and evacuation of Nigerians abroad.
We can't immediately tell you when all the schools will be reopened. It has to work in tandem with these opening schemes. We don't want to put our children at risk.
At the moment, those who have already paid for their flights to coming from Dubai, we put a date of Monday, and we're going to do everything humanly possible.
Support is coming from the United States following a telephone conversation between President Buhari and President Trump.
President Buhari used the opportunity to brief the American president on the steps Nigeria is taking. President Trump assured that the United States stands in solidarity with Nigeria in this difficult time and promised to send ventilators to support the country in its fight against the pandemic.
The task force believes the next phase in Nigeria's fight against coronavirus requires personal responsibility and adherence to all advisories on hygiene and social distancing. In Abuja, Mitari Ikben, NTA News.
The Presidential Task Force on COVID-19 has assured both the government and people of Kano State that efforts are geared towards finding a lasting solution to the strange ailment ravaging the state and further curtail the rise in cases of COVID-19. Mohammed Rabiu Ali reports that the Technical and Logistics Committee of the COVID-19 Task Force disclosed this during a fact-finding mission to Kano.
The delegation of Presidential Task Force on COVID-19 Technical and Logistics are in Kano to evaluate, support and reinforce areas that need to be addressed together with the State Committee on COVID-19. The case of Kano State, the team leader Sani Gorzo says, President Muhammad Buhari is concerned especially with the rising cases of coronavirus and increase in the number of deaths in the last few days.
Mr. President's directive is very simple. He gave us the marching order through the Honorable Minister to come to Kano and work with the teams and find out what do they need in terms of support.
We're going to work with your team to ensure that we dig the remote and any other cause of the so-called frequent deaths.
Governor Abdullahi Umar Ganduje commended President Muhammad Buhari for his prompt response in the fight against the highly contagious disease in the state.
And I believe you are coming to Kano. You will see extensively all the areas and see where intervention will come in immediately.
It is expected that the anxiety of Kano people and other Nigerians will be met at the end of the mission. Muhammad Rabiu Ali, NTA News.
You're still watching Panorama on NTA. Let's take a break now. More reports ahead when we return. staying with us. The Senate, on resumption from its 6 weeks recess, has approved 850 billion naira new external borrowing plan from the international capital market, as requested by President Muhammad Buhari for financing the 2020 budget deficit. National Assembly correspondent Ignatius Nkwo reports.
After COVID-19 forced the Senate to abruptly adjourn on the 24th of March 2020, the legislators are now back to continue the fight from the chamber. Members of the Ninth Senate for the first time jettisoned their conventional sitting arrangement as provided in their Standing Order 11 in observance of physical distancing. Rising from a closed-door session that lasted 2 hours 30 minutes, the President of the Senate, Ahmad Lawan, reminded his colleagues of the scourge of COVID-19 and the need for legislative reinforcement.
Government has responded well under the recommendations of scientists and health experts. We will continue in our efforts in the interest of our good health.
To thank the President of the Federal Republic of Nigeria for how far and what he has done so far.
Reviewing the national response to the challenges of COVID-19 and the way forward was the only motion on the order paper. Leader of the Senate, Abdullahi Yahaya, and 50 other senators sponsored it.
Senate urges the executive to set up a national technical committee on COVID-19 made of relevant scientists and health professionals
to watch over these things that require funding. Let us be, as much as possible, demonstrate statesmanship.
The raging agitation that's more or less trying to rush Mr. President to reopen the country. Mr. President, I'm worried.
For the legislators, the executive needs to reorganize the national response implementation strategy and to seize the opportunity of the pandemic to restructure the Nigerian economy by appropriating 10% of gross domestic product to strategic sectors of the economy as stimulus for investment.
I commend Mr. President. He answered our calls, our cries in Kano.
There is really a need for Kano to be really supported.
We must invest in science and technology.
They observed a minute silence in honor of the late former Chief of Staff to the President, Malam Abba Kyari, and all those who lost their lives to COVID-19. Senate advised the executive to speed up the submission of the revised medium-term expenditure framework, fiscal strategy paper, and the 2020 budget for consideration. It reshuffled leadership of 3 committees. Senator Surajuddin Ajibola is now chairman Senate Committee on Media and Publicity. Senate has suspended plenary till further notice. From the National Assembly, Ignatius Nkwo, NTA News.
As part of legislative interventions to contain coronavirus pandemic, the House of Representatives passed for second reading the Control of Infectious Diseases Bill, which seeks more powers to the Nigerian Center for Disease Control to enable it effectively take charge during health emergencies, such as containing the spread of COVID-19. National Assembly correspondent Lami Ali reports.
The Control of Infectious Diseases Bill, sponsored by House Speaker Femi Gbajabiamila and 2 other members, was among the first items considered. It seeks to repeal the Quarantine Act in existence, which the lawmakers say is outdated.
What this bill seeks to do is to empower the NCDC in several areas, in matters of quarantine and the administration of public health and infectious diseases.
The bill passed second reading while consideration for passage was moved to next sitting. The motion from House Leader Alhassan Aduda on the health crisis in Kano State and the need to urgently implement presidential directives on the matter was supported by House members.
Some of the deaths we recorded may not be unrelated or unconnected with the COVID-19 infection, but it is believed, even by the medical professional in the state, that there must be something behind or aside the COVID-19.
I do not know whether it is coronavirus. Were some associated with malaria, others associated with other ailments. But Mr. Speaker, the class of people, the age of people that are dying in Kano cannot be explained otherwise.
The special intervention that has been given to Lagos and FCT be extended to Kano State.
The issue of alleged discriminatory acts against Nigerians in China under the guise of containing the spread of coronavirus was condemned by the lawmakers as moved by Representative Benjamin Kalu. House members also adopted a motion from 4 lawmakers urging the federal government to ensure the provision of personal protective equipment and regular release of special intervention funds to all federal tertiary hospitals in Nigeria. The Speaker, Femi Gbajabiamila, in an address at the commencement of plenary, commended the federal government for setting up the Presidential Task Force on COVID-19, adding that the lockdown and curfew are necessary interventions. In view of the lockdown order due to coronavirus, House members decided to adjust the standing order pertaining to sittings and resolved that henceforth plenary will be held once every week until the lockdown order is lifted. From the National Assembly, Lami Ali, NTA News.
And the attention of the presidency has been drawn to reports of delay of food trucks crossing state boundaries at checkpoints across the country as a result of the various curfews and lockdowns. A statement by the Special Assistant to the President on Media and Publicity, Garba Shehu, refers to the presidential broadcast and says the restrictions of movement as a result of the COVID-19 pandemic do not apply to vehicles transporting essential commodities like food and other health and agricultural products. The statement recognizes the PTF standard prescription for such vehicles and occupants, but submits that the country cannot afford a situation where agricultural products are being left to rot in trucks when millions of Nigerians require food to survive. And that's Panorama today. Thank you so much for being a part of it. I'm Elizabeth Omori. Good afternoon.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
Ladies and gentlemen, let me remind us all that this pandemic is spreading like wildfire. We must all arise to fight this potent and invisible common enemy by adhering to the guidelines and protocols for COVID-19, which includes personal hygiene, social distancing. We must wear masks in public places, obeying the stay-at-home order, and reporting unusual illness to the authorities for investigation.
NTA, you can't beat the reach.
This is the network service of the NTA.